Assalamualaikum, hello and namaste. Welcome to my channel. Today we are going to talk about polycystic kidney disease. This entire video is dedicated for medicos or people who are interested in knowing about the kidney, जैसे कि स्टूडेंट्स हो गए, साइंस स्टूडेंट्स हो गए, नीट के स्टूडेंट्स हो गए, या फिर इवन इट्स गोना बी प्रोडक्टिव फॉर एग्जाम्स लाइक नीट पीजी, USMLE and everything. But this topic is very interesting and I would really like to share my way of learning with this topic ताकि आप में से किसी को भी ये बहुत ही ज़्यादा helpful हो. Coming to polycystic kidney disease, so it is of basically two types. पॉलीसिस्टिक मतलब क्या, बहुत सारे सिस्ट फॉर्म हो रहे हैं आपकी किडनी में, ठीक है. वन इज़ ऑटोसोमल डोमिनेंट पॉलीसिस्टिक किडनी डिजीज़, whereas the other is autosomal recessive polycystic kidney disease. कमिंग टू डोमिनेंट, इसका इंसिडेंसेस पहले डोमिनेंट की तरफ देख लेते हैं. 1:400 to 1:1000. ओके, मीन्स इट इज़ मोर कॉमन. Coming to the genes which are affected, PKD1 on chromosome 16 and PKD2 on chromosome 4. 16 और 4, ठीक है. 1 और 16 आप इससे याद रख सकते हैं. PKD1 में 1 है, 16 में 1 है. ओके, PKD2 chromosome 4, nothing but 2 times 2, 4. What are the protein defects which are seen in autosomal dominant polycystic kidney disease? Polycystin 1 and polycystin 2. These two proteins are defective in autosomal dominant polycystic kidney disease. Coming to histological appearance, basically the cystic dilatation is overall in the entire kidney, ठीक है. एक जगह पे localized नहीं है, it is present in the entire kidney. Cystic dilatation of all parts of the nephron are involved with normal renal parenchyma. Okay, whereas over here it will be different. It will be mostly focused on collecting ducts. We'll get there. And coming to the age, middle age, adulthood, it is more common. Renal failure and rupture of berry aneurysm are the complications, ठीक है. Complications are renal failure and rupture of berry aneurysms. Okay, now coming to autosomal recessive polycystic kidney disease, incidence is 1 in 10,000 to 1 in 40,000. मतलब it is more rarer than autosomal dominant. Okay, and the gene which is involved is PKHD1 on chromosome 6. Okay, what are the protein defects? We have fibrocystin protein defects. Okay, what is the protein defects which is seen? Fibrocystin protein defects. Now coming to the histological appearance, diffuse cystic dilatation of the collecting ducts. Okay, with the long axis of the cyst perpendicular to the capsule. मतलब collecting duct में तो effect हो गई है, ठीक है. collecting duct effect तो हो ही रहा है, उसके अलावा its long axis of the cyst will be perpendicular to the capsule, जिसका मतलब कि ऐसे परपेंडिकुलर जाएगा कैप्सूल के. ओके, सिस्ट का जो लॉन्ग एक्सिस है. एंड इट विल ऑल्सो इन्वॉल्व द रीनल पैरेनकाइमा भी इफेक्ट होगा इन ऑटोसोमल रेसेसिव. whereas over here there was a normal renal parenchyma. Okay, in dominant it was a normal renal parenchyma, but in case of recessive there is a involvement of the renal parenchyma also. Age of onset will be infancy in recessive. Okay, complications: in utero fetal demise, neonatal respiratory distress, renal failure and liver failure. Okay, renal failure और liver failure बहुत common होता है in patients suffering with autosomal recessive polycystic kidney disease. उसी तरह हम यहाँ पे ज़रा सी ये देख लेते हैं कि ग्रॉस कैसे दिखता है ऑटोसोमल डोमिनेंट पॉलीसिस्टिक किडनी डिजीज. देयर इज एन एनलार्ज किडनी. ओके, देयर इज एन एनलार्ज किडनी and these spherical cysts will be present. So these are the cysts, fluid filled cysts. Okay, इसमें fluid filled होगा. These are the glomeruli and these are the interstitial fibrosis. यहाँ पे बीच में between the cysts you will find interstitial fibrosis. Okay, So there is enlarged kidney with spherical cysts, and this one is a microscopic image with renal fluid cysts lined by flattened epithelium with the presence of interstitial fibrosis. So these are the cysts, okay, and this is the fibrosis which is present. Fibrosis is here, fibrosis is here, okay, interstitial fibrosis. Coming to this one, this is left side, this one is the adult recessive polycystic kidney disease. Recessive है ये. Uniformly multicystic distribution between the effacement of the kidney parenchyma. There is involvement of the renal parenchyma, like I told you. There is effacement of the kidney parenchyma, okay, and this mostly involves the collecting duct. Corticomedullary differentiation is not visible. There is dilatation of the renal calyces and pelvis. There is fusiform dilatations of the renal collecting ducts. This is very important point. There is dilatation of the fusiform dilation of the renal collecting ducts. So how would that look basically? ये fusiform shape होता है आपका, ठीक है. So there is fusiform dilatation of the collecting ducts का fusiform dilatation. Okay, that is seen. Now one more type of kidney disease is present, which is called as multicystic dysplastic kidney. Okay, there will be multiple large cysts in this kind of condition, and microscopic image mein there will be cysts and there will be immature parenchymal cells and metaplastic cartilage. Okay, there will be metaplastic cartilage and immature parenchymal cells. It is not that important, but you can keep it in mind. This is how it looks. There is immature parenchyma, there is metaplastic cartilage, and there are multiple large cysts. Okay, now coming to the subject wise integration, like what are the causes, what are the clinical features, how will you diagnose, how will you treat the disease. Okay, most common, it is the most common type. Okay, asymptomatic in most individuals and greater than 30 years में ज़्यादा देखने को मिलता है. 10% children suffer from autosomal dominant polycystic kidney disease. Okay, one more thing is liver and pancreas में ज़्यादा involvement होता है. Okay, this metastasis can be seen or in the liver and the pancreas. They can be cysts present. Coming to clinical features, क्या clinical features देखने को मिलेंगे? किडनी रिलेटेड जो भी होगा उसमें हीमाटूरिया और हाइपरटेंशन बहुत कॉमन है, मेजॉरिटी ऑफ डिजीज. एंड नाउ इट इन्वॉल्व व्हेनेवर किडनी डिजीज इन्वॉल्व द cysts, remember there will be flank pain also. There will be flank pain. Flank pain means it involves cysts or calculi. Even in renal calculi you can find flank pain. Flank pain means this is your body, now these are your flanks, the sides. Okay, now there will be pain on the sides. Risk of cerebral aneurysm is increased, and also there is sharp localized pain. There is chances of mitral valve prolapse and cerebral aortic aneurysm. Okay, there is. Now coming to recessive. Recessive में the clinical features are not that different. Mainly there is hypertension, there is abdominal distension, there is flank masses present here. Okay, and also it will be diagnosed prenatally. As I told you, it's more common. Recessive is more common in infants, so we can diagnose it prenatally. Large palpable kidney can be seen on palpation. Okay, coming to diagnosis, you will do ultrasound and you will do CT scan. CT scan में in CT enhanced CT, contrast enhanced CT you will be doing for dominant. So I'll show you a CT picture of how ADPKD looks like. Okay, so this is how it is. This is very crystal clear picture of the entire cysts can be figured out here. This is how it look in CT. This is how it look in X-ray, abdominal pelvis. This is how it looks in USG. Okay, this is how it looks in USG. You can see the cysts here. Okay, black cysts. Okay, Now coming back to the other things, like there can be multiple bilateral cysts will be seen in USG and CT scan. Genetic testing, as I told you, autosomal dominant के लिए you have PKD1 gene chromosome 16, PKD2 gene chromosome 4. Okay, 1 16 2 double करो 4. PKHD gene can be seen in autosomal recessive polycystic kidney disease. What are the complications of recessive end stage renal disease? ESRD भी बोलते हैं इसको. UTIs can be present, okay, if it is not treated. Then, so how will you treat the patient? First, you do BP control, because of hypertension is one of the clinical symptoms. So we are going to control the BP using ARBs and ACE inhibitors. We will start high fluid intake, and we will start dialysis of the patient if it is proceeding towards end stage renal disease. And also we can go for renal transplant as a last resort. Okay, so this was about PKD. Coming to one more important topic, that is nephrolithiasis. This I will be taking care of in next video. But if you have any doubts regarding PKD, then do please message me, or you can comment. And make sure to subscribe my channel for more such informative videos. And make sure that you keep studying and keep growing. And if you have any comments, any suggestions of how I can improve on my teaching, then please do let me know. So please follow me, and please like and subscribe my channel. Thank you.